Everyone. Thanks for coming back for part 2 of our pet first aid series. This is my cat, Darcy, and she's going to help me demonstrate reading vital signs. So vital signs are an animal's respiratory rate, so how they're breathing, their heart rate. We also want to check their temperature, the condition of their mucous membranes, and then capillary refill time. So I think since there is a range of normal vital signs for each animal, it's important to set a baseline while your animal is healthy and relaxed. Darcy is very eager to participate. To check on their respiratory rate, I like to sort of have one hand on the side so I can feel her breathing and check on the condition of her breathing, like if I feel any crackles or anything. And then I'm also going to watch her abdomen as it's going in and out as she's breathing. And over 30 seconds, I want to count how many times she's breathing in and out, and then multiply by 2 for a rate over a minute. So I'm going to try that now. I can tell that she's a little excited because I have some salmon treats right here as a bribe. I actually recommend doing this while your animal is napping or they're at rest to get a good feel for their baseline. To measure the heart rate, it's not very useful to try on the neck like it would be for a human, especially if your animal is a cat and they're purring like Darcy is now. You're just going to have a hard time feeling their heart rate. So I like to go on the femoral artery right here, right where their leg is meeting their body. Hi. And since that can be a little bit more intrusive, I'm only going to account for 15 seconds. Try to avoid having your whole hand or your thumb on the area that you're measuring. Otherwise, you might be feeling your own pulse. Hi. Okay, this is Darcy's least favorite part. Well, maybe second least favorite. I'm not going to demonstrate taking an animal's temperature because that is really not their favorite thing. But a rectal thermometer might be something that you want to invest in if you don't already have one at home. All right, Darcy, you gonna let me check your mucous membranes? So the mucous membranes that we want to pay attention to are on the gum. So if you just lift up the lip and see what's going on there. I know for Darcy, she has a little bit of periodontal disease, so I expect to see this a little bit red on the top, but then the rest is a nice, healthy pink. If it were to be bright red, I would have reason to believe that maybe she's encountered a poison or is possibly experiencing heat stroke. She's getting too hot. If they are a bright blue, that's a signal that there's a lack of oxygen. If it's kind of a muddy bluish gray, that might be poor circulation. And then white is something that we don't really want to see either. The other thing that you can check is the capillary refill time. For all cats and dogs, a normal capillary refill time is going to be 2 seconds. The way that we check that is by pressing down on the gum. Again, gently. It'll turn white right away, just like if you were to press on your fingernail. And then we want to see how long it takes to get back to the normal